You have different parts of your body that help you every day. In your head, you have your brain. Your brain helps you think, talk, learn, see, and remember everything that happens around you. One part of the brain helps you remember. This part looks like a seahorse and holds all your memories. If you ever hit your head, you could end up hurting the seahorse. If this part of your brain ever gets hurt, you can end up not being able to remember things. If you can't remember things, you could end up having amnesia. Anterograde amnesia is when you can't make new memories, but you can remember old ones. So you'll always remember your favorite type of ice cream or your favorite toy, but you may not remember getting a new toy after the accident.
The brain is made up of many different structures that help you in everyday life. One of the structures in the brain helps store your memories and is called the hippocampus. The hippocampus looks like a seahorse and is located near the middle of your brain. If you ever damaged your brain, like if you hit your head on the ground really hard, you could end up damaging your hippocampus. Any damage to your hippocampus leads to the cells in that area dying, and they can't do their job anymore, and you may not remember things or be able to make any more memories. If you can't remember things, it could be because you have amnesia. There are two types of amnesia. One of the types is called anterograde amnesia. Anterograde amnesia means you can't make new memories. So anything that happens after you hit your head, you won't be able to remember. But you will remember everything that happened before you damaged your brain. So you would be able to remember your own name, your dog's name, and where you live. But you wouldn't remember any trips that you would have gone on after the accident.
The hippocampus, a structure in the brain, plays a vital role in storing and consolidating memories by strengthening the connections of different groups of neurons within different regions of the brain. The hippocampus is located within the medial temporal lobe, near the middle of the brain. Lesions to this area or any damage to the hippocampus can lead to amnesia. Amnesia is when a patient's explicit memory is affected. Explicit memory is more focused on facts, while implicit is more about habits and actions. Explicit memory, also known as episodic memory, involves facts, events, spatial and working memory, such as what happened during class and what you learned while you were in class. Implicit, also known as procedural, is more knowing how to ride the bike you rode to class, which seat you prefer, and how you usually take notes. Amnesia affects episodic memory. There are also different types of amnesia. The two types of amnesia are anterograde and retrograde amnesia. Anterograde amnesia basically means the patient can no longer make new memories after the event that caused the amnesia. So while they may remember what they got for their birthday last year and their mom's name, they won't remember a conversation they had 2 days after the traumatic event. While in retrograde amnesia, some of your memories may be restored gradually after time, there would not be any recovery from anterograde amnesia, and the patient will no longer be able to make memories ever again.